Hi, and welcome back to the Tooth Doctor YouTube channel. I'm here today with Dr. Peter Yoo, the Tooth Doctor. Thanks so much for joining us. Today we're going to talk about proper dental implant care. So I like to start with a quote. Success is the sum of small efforts repeated day in and day out, by Robert Collier. That actually reminds me of just brushing your teeth day in and day out. You'll have success with keeping them healthy and whole. It just reminded me of, just every day repeated. According to numbers from iData Research Inc., around 90,000 dental implant procedures were performed in 2005. Still a huge number.
Very big number.
So, Dr. Peter Yoo, tell us why you're such a big proponent of dental implants.
There are many things in life that you need, that you want. And I was told by a colleague, a friend, he says, you know what, when you get older, there's going to be a point where you can't play sports. When you get older, there's going to be a point where you can't travel, okay? And a lot of times because travel insurance to go somewhere is very expensive if your health is not very good, okay? There's going to be a point where maybe sometimes you can't even walk, okay? The one thing you can do when you're 90 years old is enjoy a nice piece of cake or steak or whatever, if you have your teeth, right? That was really resounding in my mind, right? That, having good teeth is actually a big proponent of having good health.
Well, there we go. So what are implants made out of?
Implants, the actual screw component is made out of titanium. Okay, the main ones are made out of titanium. It was found some sort of dog research. I remember that they were just testing something, and what they found that the bone actually would start to stick to the titanium plates that they did in this research, and that's how they found out, titanium works. Okay. And it doesn't cause a reaction, and it doesn't cause any infection. So there are other implants out there, ceramic, ones that are like white. I'm not too familiar with them. They are kind of newer in the market. They say that they work just as well, just to hide coloring through the gums and things like that, but I'm not too familiar with that.
Okay. Obviously, these materials don't get cavities like natural teeth. What can happen if someone doesn't care for their implant?
There are many things that can happen with implants. Not to scare everyone. Again, I believe that implants are very successful if you take care of them. Yeah. Okay. The problem is when you don't take care, when you decide that it's not important to go see your dentist on a regular basis. You have imbalances. So things that I've seen are when the implant screw gets loose and the tooth gets loose and it hurts to bite on. I've seen where the screw breaks. I actually had a patient that came in that actually cracked the implant because they were biting too hard.
Oh, wow.
Yeah.
Okay, leads me to my next question. What is implantitis?
Implantitis. Anything that you see that ends with ITIS,
like appendicitis,
gingivitis, okay, basically means inflammation. Okay, so when you have implantitis, it's an inflammation or infection around the implant. Okay, and that's caused mainly by bacteria because of improper cleaning, maintenance, pockets developing in those areas.
Okay. So even though an implant cannot get cavities, is calculus buildup still a concern?
Yes. So the implants don't get cavities, but I always tell my patients that implants can get bone disease and gum disease just like your natural teeth. Wow. Okay. So the simple rule is your implants are only as good as your teeth. So if your teeth aren't healthy, your implants aren't healthy. So I never place an implant. I never want to place an implant on someone who I know that the rest of their teeth aren't doing well, aren't doing healthy. I've seen people, they come in and they have no teeth left, but they have these 4 implants that are in the gums and they're covered, but I'm like, I can see what happened, that I can just picture what happened with not taking care of their teeth and then losing them, and these implants that they were hoping to place to balance out with the rest of their teeth just didn't end up working out.
Wow.
Yeah.
Okay, how does an implant affect the surrounding teeth?
Well, the surrounding teeth, it provides support, okay? So if you have one more peg, it just allows for less pressure on the other pegs. The implant also keeps stimulation of the bone around its area, okay? But what does that mean? It's also protecting the bone that are next to the other teeth. So when you have an implant there, the bone doesn't shrink, which reduces recession on the other teeth, gum loss, and so then the roots of the other teeth aren't exposed, cause possible cavities or sensitivity.
Okay.
Yeah.
Can someone brush and floss as they normally do, or are there additional steps to care for an implant?
Mostly taking care is like your natural teeth,
Okay.
right? So that's why implants are there. So brushing, flossing, there's a little bit of a style to flossing with your implants. You know, most people floss up and down between their teeth.
Yeah.
And they may do a little J or C
Oh, yeah.
curve as they're cleaning their teeth. With implants, it's, because it's rounded, there's sometimes kind of a cross figure eight type situation where you floss and you kind of floss through it. I know it sounds silly, but it's something that, I would recommend you coming to see us and we can tell you all about that.
Right. Yeah, that makes sense. Okay, do you recommend electric toothbrushes, water flossers, mouthwashes as additional preventive measures?
Yes. With implants, a lot of times it's very difficult to keep things clean. I know a lot of patients that have implants with dentures that are held by the implants, and so water flossers help to get underneath and keep the implants nice and healthy in areas where your toothbrush just cannot get into. So your water flosser, I wouldn't necessarily recommend, I don't think there was toothpicks, but yeah, water flossers, mouthwash, just to get into those areas will be very helpful to maintain the bacterial, keeping the bacteria down.
Got it. Okay. How do night guards or retainers help prevent open contacts?
Night guards and retainers. Well, you know what? With when you have implants, when you want to keep things stable, okay, things can always shift. So having a night guard is basically like a retainer. Okay, it holds your teeth together, and so that prevents the teeth from opening up. I have met a patient where we had an implant done, and for some reason, a few years later, there was an open space between the tooth and the implant. We were trying to figure out what's going on, but everybody knows an implant doesn't move. Like once it's in the bone, it stays there.
Yeah.
So something must have happened with the teeth to cause the shift, and so there was a little bit of space and food kept going in there, so we had to deal with that. But having a night guard or retainer would have held the teeth in their position and prevented things like that.
Okay. Are dental implant patients required to visit the dentist more often?
I wouldn't say more often, but on a regular basis. Okay. One of the things that we do for our patients that have implants is to check their bite. Okay. Now people are like, well, what does that mean? Okay. You have to understand that an implant, okay, and your tooth, okay, when you bite down on a tooth, the tooth actually moves down. Okay. An implant, when you bite on it, does not move. Okay.
Right.
So when you're biting your teeth together, okay, if you bite really hard, what's going to happen? Okay, I'm exaggerating a little bit, so you on TV can see what's going on with my hands. Is that when you bite hard on your tooth actually shifts down a little bit. Okay, well, what does that mean for your implant? It means you're biting really hard on your implant. Okay, so on a natural, when your mouth is resting and not biting, your implant needs to be at the same height as when you're pressing down on your tooth. So at a natural state, your bite should actually be like this compared to your implant. Okay, there should be a slight gap between the tooth and the implant compared to your tooth and your tooth. Okay, because when you bite really hard, that's when your implant and your tooth will touch. And so we check that and make sure there's a very slight spread with your implant so that you don't end up chipping the crown, breaking it, causing other problems in the future.
Oh, that makes sense. I didn't know that. How can someone get started with the tooth doctor if they think they might need an implant? What should they do?
Well, we recommend you coming in. Obviously, we want to make sure if you've have a regular dentist or if you've seen a dentist before, we want to make sure that everything's healthy. As I said before, an implant is only as good as your teeth. So we want to make sure your teeth are good, they're healthy, there's nothing wrong with them. You know, placing an implant in an area, we want to obviously make sure the teeth that are beside those teeth, there's no cavities or any issues with them in that regard. And then from there, we can do proper assessments. We take impressions, we'll take x-rays to see the health and the quality of the bone, the thickness of the bone, and that's where we can decide, you know, what size to use, and then basically get the ball rolling with planning the appointments for placing the implant, and later on doing impressions and placing a tooth on top of that implant and feeling brand new again.
Yay.
Yeah.
Sounds good. So don't hesitate to call the tooth doctor or like the video, leave your information, and also don't forget to subscribe to the channel. We'll have lots of more great information coming at you all the time.
Okay.
Thanks. Bye.